Well, let's talk about the latest pandemic news with my guest now, Dr. Nisreen Alwan. She's an associate professor in public health at the University of Southampton in England. Thank you for being with us, Ms. Alwan.
Thank you, Natalie.
Yeah, good morning to you. I want to first start with the World Health Organization now saying that there's currently no evidence that people who have recovered from COVID-19 have antibodies and are protected from a second infection. How does that complicate trying to move forward from where we are right now?
Well, I think the WHO is right to call this out, because we still don't know how much immunity this virus will induce in people. We know it's likely. We don't know how long it is, how much it is. So I think it's right, because the idea of having immunity certificates, for example, is potentially dangerous, and that may mean exposing people to high doses of the virus if they're on frontline healthcare workers, for example, without adequate protection. So it has all sorts of implication. So I think it's right for the WHO to announce that. It does complicate matters, but we still don't know, and time will tell.
Well, countries in Europe are starting to ease lockdowns. In the U.S., the White House wants people to stay home through the end of April, but some states, as we just reported, are already opening businesses at a time when infections are still rising daily. Do you have concerns it is too risky to do that right now?
The concerns are really that any ease down of the lockdown should be accompanied by a detailed plan of how you find cases and isolate them. If this is accompanied by such plans, then obviously lockdown has so many adverse consequences that you'd like to ease it as soon as possible. But if there's no such plan, then we are risking second waves and subsequent lockdowns. So there needs to be a detailed plan of how you find cases, how you isolate them, how you screen people, particularly to find the asymptomatic and the pre-symptomatic cases.
Well, as far as screening goes, Dr. Anthony Fauci is saying that the U.S. should double testing in the next 2 weeks. Of course, the UK has lagged in testing as well. Should it be feasible, doable to do at this point? And how important would it be to reach that goal?
I believe it is feasible, because if you really weigh it's a complex. There's a lot of logistics, a lot of resources involved in ramping up testing. But if you weigh this against all the economic consequences of lockdowns, extensive testing, screening will win in that equation. I'm not an economist, but people have done calculations to suggest that it would make, the savings would be huge. So I think it is feasible. And that's what we should do. There's new modeling from Imperial College, for example, showing that if you screen all healthcare workers, even if they're asymptomatic, you can reduce transmission by about a third.
Well, I want to speak with you to another area regarding your expertise. This pandemic also brings up the issue of public health and adverse consequences of the lockdown where it comes to poverty, domestic abuse, mental health. It's not a simple public health versus pick up the economy equation. Can you explain that?
Yes, of course. The dichotomy between public health versus economy is not helpful. Public health has always been a consequence of the economy, and we've got the socioeconomic factors determining public health pre-COVID. And now it's similar. The disadvantaged groups of society are, massively impacted by COVID and what's happening more than others. And also the economy now really at the mercy of public health. I hope this would make us realize that the economy can only be as healthy as the most vulnerable member of society. So any exit strategy needs to be equitable in terms of who can access the benefits of it.
Very well said, and that's an important part of this whole story. We really appreciate your expertise, your insights, Dr. Nisreen Alwan. Thank you so much for joining us.
Thank you so much.